Hedgehogs.
I love hedgehogs.
Why can't they share the hedge?
Aw, why can't they?
Welcome to ClackCo Works, chats with the people who make Clackamas County work for our community. Today we are joined by the lovely Mary Rumbaugh, who is the director of the county's Health, Housing, and Human Services Department, known as H3S. Thanks for being here.
Thank you.
All right. So, as I said, H3S, Health, Housing, and Human Services. It's the largest county department. Why don't you tell us a little bit about it, what it does?
Sure. Well, I can easily break down what we do by the title of our department. So starting with health, we're the largest health clinic here in the county. So just last year, we served over 18,000 individuals across primary care, dental, and specialty behavioral health. And we have locations here in Oregon City, Milwaukee, as well as in Sandy. We also serve this community through our urgent mental health walk-in center, and we served over 800 individuals last year, took 13,000 calls to our crisis and support line, and served over 600 individuals through our mobile crisis response team. That means going out to the community wherever somebody is having the crisis in their home in another location.
Yeah.
So that's health,
Right.
so quite large.
Yeah.
Housing. So housing has gotten a lot of attention over the last several years for very good reason. We're very committed to addressing our homeless population. We believe that housing is a right for everyone. In the first 5 months of this year, we saw over 10,000 calls to our coordinated housing access line. That is the line that people can call to get support for housing. And over 6,000 of that was around helping address eviction for those individuals. So we're getting a lot of calls, which is amazing, and those calls are almost always answered live as well. And then we, through permanent supportive housing, we've housed just over 1,000 households. So we are making a small dent in a really big problem, which is really important. Those are two big areas, but we do so much more. So the human services side of it, we serve veterans. We help older adults get to appointments. We help new families through our Women's, Infants, and Children's program. Early learning is very important for us. And we're out making sure that our restaurants pass inspection, that our pools are clean, and that we are responding to diseases that might be out there in the community through our public health division. So we do a full array of services with well over 800 employees doing that work every day.
That's the biggest county department, right?
That's correct.
Yeah. Nope. You all do a lot of work, and it's hard work, and we're all better for it. That's a lot of people that we help to serve every day.
Yeah.
That's great. So I think we're going to spend our time today talking about the recovery-oriented system of care, which is something that Clackamas County has focused on for the past couple of years, and people might have heard about with just in their dealings with the county. So to start off, why don't, if you can, walk us through what exactly a recovery-oriented system of care is and how it's different.
Yeah. So, we did look to the federal definition for what a recovery-oriented system of care is, but we really want to put it in a framework in which anyone in this community can understand. And it really is a continuum of services. It's designing services that meet individuals where they're at, whether it's recovery from a substance use disorder, from mental illness, from, unstable housing, or chronic homelessness, which has huge impacts on people's whole health. So we're looking at what we have today in the county around some of those services that I talked about, but then we're looking at where we have gaps in this county, and we're going to be creating a continuum of services so that it is whole person care. We're really meeting the individual where they're at and what they're ready to do, and we're building on their strengths and on the resources that they may also have. And so that's really for our community to understand what does a recovery-oriented system of care look like. It really is about designing those services and supports for this community, and not a one-size-fits-all.
Right. Okay. And just to be clear, all the services that you mentioned before for public health or health clinics, those have been in existence for decades and decades.
Correct.
And even serving the community. It's just a different way of looking at it just recently.
That's right. That's right.
So let's talk about the origins of it from the county's point of view. So the recovery system of care came about, I think, in around April of 2023 through a board resolution.
Correct.
The Board of Clackamas County Commissioners. And they did it by resolution to address the addictions, mental health, and homelessness crisis.
Correct.
Is that right?
That's correct.
Okay.
That's correct. And following that resolution, they then, in the fall of 2023, hosted a summit, brought in local experts, national experts, international experts as well, to really, our goal was to not sort of start over, but to really learn from some best practices that are happening not only locally, but across this country, and really then look at the way that Clackamas, we often talk about the Clackamas way, how do we really adopt some of those best practices and make sure that it works then for this local community. And we've been off and running ever since that summit.
Yeah. So what are some of the real impacts that people are seeing or might have seen? Like, since we did this reorientation, where might the community be able to see, yes, this is going to make a difference? Where are sort of investments in this area?
Well, so we have a couple of new investments that are coming online, but I would also like to say that some of the important work that we've done is just to also tell the story. And so we've done some stories of recovery, so hearing from individuals around what would their recovery have looked like had we had, for example, the recovery campus that I'll talk about in just a moment. And I think that really hearing from individuals who would have been impacted and who will be impacted is really important for me in my role to address the stigma that happens. There's a lot that we don't understand about somebody's journey, whether it's substance use, houselessness, or mental illness. And I think hearing from folks with that lived experience who have really walked that journey becomes really important. So I think we've already done some amazing work even before the buildings get built to make sure that we're addressing the stigma that often happens with individuals who are struggling in our community.
Yeah. Okay. Nope, that's very important.
Yeah.
So what are some of those investments? You touched on the recovery campus.
The recovery campus really was an output of the summit. So we knew pretty quickly that we would need to start looking for an actual location, and so we were able to purchase property at the end of 2024, and we've been in design for what we are calling a recovery campus. It's a continuum of services starting from withdrawal management, which people often refer to as detox, to residential, to outpatient services, to peers. So peers are really critical as part of the continuum, individuals with lived experience. And most importantly, the difference on our campus, maybe compared to other campuses across the state, is recovery housing. So we really allow people to move a little more quickly through the treatment aspects if we actually have recovery housing for longer. A lot of people don't need months and months of treatment. They need that short-term treatment, and what they need is really a recovery community.
Right, but just to be clear, the primary focus of individuals, or the target, if you will, are people who are suffering from substance use.
That's correct. Okay. That's correct. We expect that that will be the primary adults with substance use disorders. Also may have what we call co-occurring, also some mental health. And there will be a portion of those individuals who are either currently experiencing homelessness or have experienced homelessness there on that campus. So that's in design right now. More immediate opening is our stabilization center located in Milwaukee. And this is two programs that are complementary to one another. This will be focused on adults with mental health concerns. And so what we're calling the 23-hour crisis stabilization, it's open 24/7, and individuals in the community experiencing a mental health concern that cannot be stabilized in their home or community, but do not need to go to jail and do not need to go to the hospital, can be brought to the stabilization center and stay up to 23 hours. So law enforcement and mobile teams will be the primary referent for that program. And then there's a complementary program, what we call housing and case management. So maybe somebody who came to the 23-hour program needs a little longer than 23 hours. They can be referred to the housing and case management side of the program, 30 to 60 days. Most of those referrals will come through our coordinated housing access line that I was just talking about. a few minutes ago. And again, these are individuals where they're struggling with their homelessness. And so this is a safe place
Right.
to get them a little bit more set and get referrals to long-term permanent supportive housing.
Right, and that's a key point too, because if people go into either the recovery campus or the stabilization center, at that point, if they haven't already been, they get plugged into the Clackamas County sort of network.
Right.
And so it's not just one-stop
That's
shop
right.
where it's like, okay, once you're done here, you're gone. It's if they need, more housing assistance or they need these other services that, that your department is dedicated to, they get plugged in sort of immediately.
That's correct. That's
right.
correct. Our hope would be that there's no wrong front door, right?
Right.
And so that we get
Right.
folks just connected, and even if really long-term what they need is more stable housing, then we have some other resources. So the other program that will be coming online is Caring Place. So this is an important partnership. It is really our homeless services resource center. It will be the day center. Folks will be able to get connected to housing, just basic needs, shower, clean clothing, as well as some other social services. So it could be that an individual, that will be in Oregon City, it could be that an individual, comes to the day center, and we realize actually they've got some other things happening, and so
Yeah.
we're going to make a referral to the recovery campus if they're open to that.
Right.
So all of these services are going to be coordinated through just really important communication and partnership, and it really will be a game changer for this community.
Yeah. No, that's great. And so to bring it back to what the board did, the Board of County Commissioners back in 2023, when they they supported the ROSC, the Recovery Oriented System of Care, specifically for addictions, mental health, homelessness. The three examples that you just named, for addictions, the recovery campus, for the stabilization center, deals with mental health, has homelessness too. For Caring Place, homelessness.
Correct.
And that's really what this is about, addressing these ongoing crises, because that's what residents have told us. Those are the biggest issues that they see in the county.
Correct.
Yeah. Okay. Are there any other investments that we should talk about?
Well, we do have, with our new courthouse here up in Oregon City, we did need to relocate our specialty behavioral health clinics.
Right.
And so the Lake Road Health Centers is open and running, but it's still under construction. So
Right.
it should be fully utilized here by the end of this year,
Yep.
and we will be able to just serve a lot more folks. It's a bigger building,
Right.
so that's very exciting.
great.
We just opened the Clackamas Village as
Right.
well, which is right next to Vets Village, and that was a really exciting groundbreaking. And again, just a very focused, trauma-informed, really compassionate place for our houseless individuals
Right.
to stay for a period of time.
Yeah.
And so we're really excited about those investments. And so as much as the recovery-oriented system of care really gave us the framework, there were also a lot of important work already happening.
Yep,
And so
absolutely.
I think what's been exciting is for us to be able to say, oh, and even though this isn't just the recovery campus, this is about a recovery-oriented system of care. And we don't want to create a one-size-fits-all. We want a continuum of services that meet
Yes.
the needs of that particular individual.
That's great. I guess final question: What are you overall hopeful for with the transition? I guess in the future, and how will this help the community?
Well, I started with the conversation about sort of awareness. I really hope that we can continue to really support our community and our neighbors who are struggling. And I think by creating these resources, it really is a pathway for helping folks get on their road to recovery.
Yeah.
So ultimately, my heart is in this work. I've worked for the county for 25 years. I believe in the work that we do. I believe that everybody in this community has, the right to a safe place to live and to get the supports that they need when they need them and when they're ready for them. And
Yeah.
so I think we're here for that. And so I'm excited for this investment, both, on paper with the resolution, but also some amazing partnerships as well at the state level, local level, to
Yeah.
really say, okay, say, we believe in your vision, and we're going to be a partner in helping, create that. So I believe that we change lives every single day.
Yeah.
And really with these investments, we're going to continue to change even more lives, which is really, that's what keeps me coming back every single day.
I think we're a better community because of your heart.
Thank you.
So thank you for all the good work you do.
Thank you.
And thank you for joining us today. This is great.
Thank you.